Thank you, Jane, and thank you for inviting me and for everybody who is here today to listen to this topic which has been keen to me for such a long time. I am a registered nurse and spent my first 7 years in a pediatric emergency room and then school nursing, and then watched what the Clintons wanted to do and said, somebody's got to stop that. Let's start an organization. And so we've been around for 24 years now and have been fighting against the Affordable Care Act and anything that looks or acts like socialized medicine, no matter how it's disguised. Well, this is about banishing Big Brother in the exam room. So I believe that patient and doctor freedom are essential to freedom in this country. They are connected. If the doctor and the patient can't be free, it's hard for any of us to be free. And I learned very early that he who holds the data makes the rules. And because of that, what it means is that privacy is foundational to freedom. Freedom for the patient, freedom for the doctor. Thus, Hipaa was the beginning of the end of privacy, and with it a full assault on the freedom of the entire country began. But actually, the end of privacy and physician autonomy began in the 1940s when Congress decided to let employers offer health insurance as a tax-free benefit. So Big Brother in the exam room arrived with employers and their third-party administrators, government agencies, and their contracted health plans and collaborative health plans, and now the health IT industry with their in-the-cloud servers and their control over the EHR. Banishing Big Brother is no small task, but it can be done, and it must be done if we want freedom for patients and freedom for doctors in this country. But it can only be done by getting to the root of the problem, or, given that I'm in an audience of physicians, to the growth plate of the issue. That's why I bring up the third-party payer problem in the 5th paragraph of the entire book, because I want people to see that that is the root of the problem, moving to a third-party payer system. That's also why there is a timeline in the back of the book that starts in 1942 and goes all the way to 2017 to show you how Congress advanced the idea of having a third-party control what happens in the exam room. So I'm not going to be shy about saying I really want you to buy the book. And I don't want you to buy the book because I wrote the book. I want you to buy the book because I want you to put it in your exam room. I want you to put it in your waiting room. I want you to put it wherever the patients can actually see it, because they have no idea what is happening. They have no idea what you're dealing with. I wrote it to change the current trajectory of medical care in this country away from socialism, back to freedom. I wrote it to make Big Brother visible. It's pretty invisible right now, and a lot of people think that that computer in the exam room is just a lovely new technology that's like the phone in their pocket. I wrote it to stop the insidious movement toward socialized medicine that will be facilitated by socialized health data systems. In America, socialized medicine will be run by the health plans, who will control medical decisions through data and dollars. Recently, an investment expert said that investors aren't worried about a single payer system because they believe that Medicare for all will be Medicare Advantage for all. Thus, it will be run by the health plans that, like United Health Group, their stock has risen 1,400% since 2009. WellCare, its stock has risen 4,000%. All it does is Medicaid, 4,000%. And so investors are not bothered by this idea because they understand that the health plans will run the socialized system. Well, the left must be smiling. Ted Kennedy authored the HMO Act of 1973 to impose HMOs across the country and to force employers to offer them offer them free because there was so much money in order for them to offer them free. And then Hillary came in with her regional alliances, which each of us would belong to a regional alliance. Within the regional alliance would be HMOs. So we'd all have to have an HMO. Then the majority of people are now today in health plans, which is the new name for the HMO. And Medicare Advantage has 30% of the Medicare population in the HMO. And Obamacare is HMOs for all, or as I said, health plans. Health plans for all, managed care for all, HMOs for all. But before Obamacare came into place, came high tech, with its mandate to buy electronic health records and to use them meaningfully. But the road to the electronic health record mandate began with HillaryCare. So just as a little bit of a reminder here, HillaryCare had administrative simplification. It had a national medical record system, quality reporting, practice parameters, national identification systems. And although HillaryCare failed, little pieces of it have emerged in other laws. So in 1996, administrative simplification became law through Hipaa. And in 1999, the Healthcare Research and Quality Act promoted healthcare quality improvement through research that develops, quote, scientific evidence regarding all aspects of healthcare, end quote. And it began data collection and reporting on quality measurement. 2006, a voluntary quality reporting system. 2008, e-prescribing mandates in Medicare. 2009, high-tech with its certified EHR mandate and meaningful use mandate. 2010, the Affordable Care Act and quality reporting now mandated through the PQRS system. 2015, we have MACRA with its MIPS and the alternative payment models and the ACOs, which have been called HMOs on steroids. 2016, penalties for information blocking. And 2017, a new version of the National Patient ID, which some of you might recall that Congressman Ron Paul, a physician himself, he stopped the National Patient ID in 1999, I believe. He completely disallowed funding for it. But in 2017, last year, there was an appropriations bill that allowed the federal government to provide technical support and funding for a national patient matching strategy. And the Pew Institute, the guy who came up with this, I heard him talk about this, he said he had to find a different name rather than National Patient ID because that was like, toxic. So he came up with National Patient Matching Strategy. And of course, what that really is a national identification, tracking, and control number. And that's what they're going to be working on. So both Republicans and Democrats are to blame. And I make that clear in the book. Well, let me just give you a short, quick overview of the book, Big Brother in the Exam Room. It's a warning to patients, and it's a tool for active engagement. It's a description of what doctors face every day. And why is that important? Because I really want lots of people who aren't doctors to read this, and I want them to see what you're going through and trying to think about data and trying to think about meaningful use and all of that. They have to see that morass that you're experiencing. It's an expose of the electronic health record. It exposes it as a surveillance system and a command and control system. So Dr. Scott Silverstein, who is one of the endorsers of my book, I found a great quote from him in a video. He calls it an enterprise-wide command and control system through which all medical transactions have to pass, controlling clinicians and clinical resources. Those of you who have the book, that's on page 8. I also differentiate between the pre-mandate electronic health record. Some of you had electronic health records you really liked. They worked for you. It was before the mandate, right? You made them like you wanted them to be. So I call this the government EHR. It's government designed, government certified, government mandated to do what the government wants it to do. And I make that clear that its main purpose is not the patient, but it's billing, data collection, and reporting. I also explain and unveil the Hipaa privacy myth. I have an entire section on that because while the American public believes Hipaa protects their privacy, they are unalarmed. Once they realize that they've been lied to, things turn differently. Dr. David Brailer said about Hipaa, I've got this great quote on page 147. You can't force a covered entity to give your data to someone you choose, and you can't stop them from giving it to someone they choose. And that really hits the heart of the patient who understands that sometimes they want to get their data to someone that's important to them, like a spouse. And then once they realize that all of this data is being shared without their consent, they become alarmed. So there's a chart in there as well of the 2.2 million entities who can have access to patient data without consent if those who hold the data allow that access to happen. And that 2.2 million number does not include any of the government agencies. I quote a lot of doctors and nurses in the clinical chaos section where I detail medical errors, the dangers of CPOE, the clinical decision support tools that they want to use to control the doctor, and the plans to use artificial intelligence and machine learning to diagnose and treat patients. I think there's probably about 250, 260 quotes in there because I really wanted the reader to see what people are actually saying. There's a section on government intrusion that describes research at the bedside, the Innovation Center experiments on patients through the Affordable Care Act, the slice and dice population health analytics. I loved Dr. Akkad's presentation this morning. And the growth of various health surveillance systems, including the prescription monitoring system. Nevada, in case you don't know it, Nevada has moved their prescription monitoring system into not just controlled substances, but every prescribed medication has to be reported to the system. And the final chapter is called A Few More Things. So I talk about the always listening Alexa and other voice assistants, the CMS effort like Blue Button 2.0, Epic's plan to use the EHR system to create comprehensive dossiers, Facebook's attempt to get medical records, the possibility of blockchain for patient privacy, ownership versus stewardship of patient data, and whether there will be a doctor in the exam room. And I conclude with what the EHR could have been, and how some say the only way to improve the EHR is to start over. There are 4 lists of steps back to privacy, safety, and freedom, one for Congress, one for state legislators, one for physicians and clinicians, and one for patients and citizens. Some of them are the same, some of them aren't. They don't have to go in any particular order. They can work together. It doesn't matter. They're just lists of actions. So I sent this list to Dr. Jane Orient, who said, amazing. I think that's what you said. But she suggested that I include one more for Congress, which I did, and you'll see it at number 27 in the congressional list. Repeal the requirement that forces physicians to file unassigned Medicare claims, allowing patients to file claims if they so choose. Thank you for that, Jane. I wanted the book to be eye-opening, eye-friendly, bulletproof, credible, policy-altering, and life-changing. There are 1,547 footnotes. I think the book is evergreen. In other words, I think it will last. It tells a history that I haven't seen told anywhere else about how we got here. And it has been number 1 on an Amazon bestseller list 3 times, once in privacy and surveillance, and twice in the medical history and records textbook category, which I thought was kind of funny. We don't get to pick what category we're in. So we have sold out most of our first printing, and the second printing will be in the warehouse in 2 weeks. And so it was interesting, a few days ago, Amazon was selling the book for $303, and that's because there aren't many copies left and they don't know that we're going to do another printing. But we are, and I would ask you to get it at here or at bigbrotherintheexamroom.com, where we get most of the money back from it rather than Amazon. And Dr. Jeffrey Singer wrote a book review for Cato Institute, which I was really pleased. And he said it's the first book to meticulously detail the ways that health information technology is being weaponized against all of us. And then he said everyone should read it, and I agree. And it's just because, I've spent 20-some years, 1996 is when I realized the problem, and it's been very hard to get Republicans to actually see privacy as foundational to freedom. And I've seen them get rid of it as much as I've seen Democrats work to get rid of it, and so I put it in a book. The computer in the exam room is not what patients think it is, and you really need to help them see that. So banishing Big Brother's control of the exam room is critical, and one way that doctors can take action is to stop signing contracts with health plans and government so you do not have to betray your patients to others. So one of our suggestions is that you go third-party payer-free, which is something that this organization talks about more than any organization anywhere else, and that you talk to your patients about why it's a good idea for you and for them to make that happen. And then once you have done it, or for those of you who have already done it, please consider joining the Wedge of Health Freedom, which is our initiative to connect third-party payer-free doctors with patients who want to pay you cash and have you totally work for them and not someone outside. And you can find that at jointhewedge.com. We have almost 300 physicians now, and I shouldn't say physicians, I should say practices. We just had our first dentist join, and we have 2 radiology facilities, one in Florida and one in Oregon, and they're all cash-based. No insurance, no government. Another action is that physicians can pull the plug. You really can. And the Illinois Pain Institute, which had a staff of 70, about 3 years ago, they took a poll amongst themselves, they voted, and they unanimously agreed to get rid of the electronic health record. And so now they just deal with the penalties, and I've talked to a lot of you and other people who say that the penalties, the amount of money that comes in or the penalties that you lose is nothing compared to all the costs. And I do have a chapter called The Costs of Coercion, which really details the direct costs and the indirect costs, including things like cybersecurity and the fact that there are as many openings for cybersecurity experts as there are cybersecurity folks in the field. And it takes 5 years to be qualified for one of those openings. So all 60,000 people who are currently in the field could all give up their job and go get one of those other openings. That's how you are unable to even protect your patients from cybersecurity threats. There are just not enough people to do it. Physicians can stop using intrusive questionnaires, coercive consent forms, and iPad signatures. Please don't use iPad signatures. I tell everybody in the book, do not sign something where you cannot actually see the words. But that's what a lot of offices are doing. They're saying, just sign here, and I never do that. I say, give me the paper form. Let patients refuse to sign the Hipaa form or the acknowledgement statement for receiving the so-called notice of privacy practices. You must make a good faith effort under federal law to get them to sign it, but there's nothing that says you don't have to tell them they don't have to sign it. And they don't have to sign it. And the federal government has a protocol for you to follow when they refuse. We have an entire refuse to sign Hipaa campaign, and people are refusing all over the country, but some of them are being denied access to care. And they're being ousted from the office because people are so afraid that they'll have a Hipaa violation. But the fact of the matter is, in the book, you will find the actual words from HHS that tells you what to do when they refuse to sign. And it will help everybody understand that Hipaa is not a privacy rule. Physicians can also inform everybody, including their staff, that Hipaa is not a privacy rule, so, freedom of speech. Physicians and patients can engage together and alone to ask state legislators to pass real privacy and consent laws like Minnesota's law, which right now, the chamber, the business partnership, the health plans, the healthcare industry, everyone is trying to get rid of our law so that we can be like Hipaa, so that they can have access to everybody's data, and we are fighting them. Finally, physicians can empower citizens and their patients with information like this book. So, I'm really going to ask you to buy several copies, and let me just give you some ideas here. Local library. Take them to the local library and see if they will stock it. Gift one to your medical school library. Send one to your favorite professor Who knows, it could become a textbook. Wouldn't that be great if all the medical students came to understand HIPAA doesn't protect their privacy and what this does? Give one to the state legislator, send one to Congress, put one in your waiting room or your exam room or all of your exam rooms. What I just want is, I made it so eye-friendly. If I could find it here, here's a bunch of quotes and this lovely little subtitle. I said, it's got to be eye-friendly. And so my publishing manager said, the thing is, you can just look through here, find an interesting topic, and read that topic and that short little thing, and then it's all done. And that's what your patients can do. They can just thumb through and find a little topic while they're waiting. So I'm just asking you to empower your patients. Engage with me and our organization, Citizens Council for Health Freedom, to put the patient and the doctor back in charge and to banish Big Brother from the exam room once and for all. Thank you.